Hello. So before I begin my assessment, I'm going to do a 365 scan of the room. Okay, to begin my assessment, I'm going to perform hand hygiene. I'm going to put on my gloves. And I'm going to wipe down my stethoscope. Okay, I'm in the room now. Hello, my name is Skylar. I'm a student nurse and I'm going to be performing an assessment on you today. Is that okay?
Yes.
Okay, I'm going to close the curtains to provide privacy. Can I please see your ID band? Thank you. Can you please state your name and date of birth?
Jody Weber Palone, November 8th, 1995.
Thank you. Do you need to use the restroom before we begin?
No.
Okay, I'm going to start off by inspecting your ears. Is that okay? Okay, I'm just going to move your hair out of the way. Both ears are symmetrical, and they're equal on both sides, and there is no discharge. I'm now going to palpate your auricle and your tragus. There is no tenderness in the auricle or tragus. I'm now going to perform a whisper test on you, where I will whisper 3 words into each ear, and you have to repeat them back to me. Okay.
Coin silver bunny.
Yes.
Ocean slide water.
Okay, thank you. I'm now going to inspect your nose and palpate your sinuses. Is that okay? Okay, the nose is midline and there is no discharge. I'm now going to palpate your frontal and maxillary sinuses. Is there any pain?
No.
Is there any pain there?
No.
Okay. There's no tenderness in the sinuses. I'm now going to inspect your mouth and your lips. The lips are hydrated and they're symmetrical. Can you please open up your mouth? And I'm just going to use this tongue depressor. The gums are pink in color and there is no swelling. The teeth are white in color and there is no looseness. Can you please touch the top of your tongue to your roof of your mouth? The bottom tongue, the base of the tongue is also hydrated and symmetrical. Can you relax your tongue? Open your mouth. The hard and soft palate are intact and there are no lesions. I'm now going to assess your cranial nerve 9 and 10, which is your glossopharyngeal nerve and your vagus nerve. So can you please open your mouth and say ah?
Ah.
Thank you. I'm now going to assess your cranial nerve 11, which is your hypoglossal nerve. Can you please say light, tight, dynamite?
Light, tight, dynamite.
Thank you. I'm now going to assess and palpate your neck. Is that okay? Okay. The neck has no scars, lesions, masses, pulsations, involuntary movements, and it is symmetrical. I'm now going to palpate your carotid arteries. Is that okay? Let me know if there's any pain. There is no tenderness or masses in the carotid arteries. I'm now going to assess your cranial nerve 12, which is your spinal accessory nerve. Can you please turn your head against resistance? Thank you. Other side. And can you please raise your shoulders against resistance? Thank you. I'm now going to assess your upper extremities. Can you please roll up your sleeves? There are no masses, lesions, or scars on the upper extremities. I'm now going to palpate your arms. There are no involuntary movements, there's no masses or any lesions or scarring, and the temperature is warm. Can you please can I please inspect your hands? The hands are consistent in color, and there are no lesions. Can you please stand up for me? Okay. Can you flex your fingers, extend your fingers, flex your wrists, extend your wrists, radial deviation, ulnar deviation. Can you abduct your arms? Adduct your arms. Can you flex your elbows? Extend your elbows. Can you shrug your shoulders and relax them? Can you do internal rotation and external rotation? And can you put your hands prone and supine? Thank you. You can sit down now. I'm now going to assess, palpate, and auscultate your thorax. Do you mind turning around for me so I can access the back of your thorax? Your posterior thorax. Okay, there are no scars, lesions, masses, or swelling. I'm now going to palpate your posterior thorax. Okay, the temperature is warm, and there are no masses, lesions, or swelling or tenderness. Thank you. I'm going to now listen to your posterior thorax with my stethoscope. Can you please breathe in and out for me? Okay, thank you. The sounds are good with no crackling. I'm now going to assess your anterior thorax. Can you please breathe in and out? Okay, thank you. Your breath sounds are good, and your breath sounds were effortless, and it was 14 breaths per minute. That concludes our assessment. Thank you.